With me now is Dr. Dale Kalina. He's an infectious disease specialist. Dr. Kalina, good morning. Good to see you.
Morning, good to see you too.
All right, so let's start there with the mask mandate. Are you going to wear a mask on Monday?
I sure will. I agree. I think that it's a little bit too soon and a little bit too rapid of a decrease of public health measures. And the reality is we do still have quite a lot of COVID that's circulating in our communities here in Ontario and realistically across the majority of the country as well. So I sure still will be wearing a mask. But also, I think it's important to recognize that masks have become this bizarre political tool here, and masks are not. We have worn masks in healthcare for years and years and years, and we in healthcare wear masks, for instance, if we have a cold and didn't want to infect other people around us. Masks are about protecting the people around you and to protect yourself. And I hope it continues, honestly, for people, particularly if they're sick, whether it be COVID or a cold, because it prevents the spread of all of them.
It's interesting because I don't know what you're hearing, and I'm curious to hear what you hear from patients and people about wearing masks. Most people that I know say they're still going to keep wearing them.
I'm hearing the same thing, and I think it's what we're seeing in a lot of larger businesses as well. I think I saw Tim Hortons the other day announce that you still had to wear a mask when you go to get your coffee in the morning as well. And I think there's been a lot of pushback, not only from school boards, but from a lot of individuals that I know that are saying, I don't feel comfortable not wearing a mask right now. And I think that it's prudent to be wearing a mask, particularly if you're indoors, if you're in areas with a lot of other individuals nearby, or of course, if you yourself feel unwell or worried. I think that it's very reasonable.
All right, let's talk about what's going on in Europe and parts of Asia where we are seeing cases go up. Often we look to other parts of the world as an indicator of what may happen here. What are your thoughts when you see rising case counts around the globe?
Yeah, so I think we can compare and contrast, say, the United Kingdom with Hong Kong. The United Kingdom has very high vaccine rates, and Hong Kong, surprisingly, maybe in the elderly population, has a fairly low vaccine rate. So where caseloads have gone up quite significantly in both countries, the number of deaths and the number of hospitalizations really hasn't increased in the same way in the United Kingdom because of that vaccine rate, whereas in Hong Kong, for instance, it really has to a worrisome level. And I would expect something very similar to happen comparing and contrasting the United States with Canada. I expect both of our rates to continue to go up, particularly as we see this BA2 subvariant of Omicron. It spreads really quickly. But because of our vaccines here, I expect fewer people to need to be hospitalized and die, which is good because we really don't have that hospital capacity here in Canada and particularly here in Ontario to deal with another wave.
Yeah, and that was really the message that we heard yesterday from the science table. Cases will go up, but we believe we can manage them. The warmer weather is coming. That may play in our favor as well. Dr. Kalina, before you go, do you expect that people will be advised to get a fourth shot of the vaccine going into the fall and winter?
We don't have a lot of evidence to support fourth doses for the general population. We certainly do for individuals who don't have a strong immune system and who wouldn't mount a good immune response to vaccines. So I still think we need a lot more data rather than simply predictions from pharmaceutical company heads.
Dr. Kalina, thanks so much. You take care. We'll see you soon.
You as well. Take care.
All right, let's look to